Privet Katila ya ni хорошо? Because today we are going to be talking about healthcare, which sounds like I need some if I'm not feeling so good. But anyway, so I'm not going to talk about my specific hot-baked takes on healthcare, which aren't all that hot to be quite honest with you, but I have my own kind of idea of healthcare in America, and it is one of the top issues in the country, justifiably so. But in this video in particular, I'm going to talk about the healthcare plans for all the Democratic candidates and try to enlighten you on where they stand, and hopefully in an objective manner. So, I'm sorry to all the Wayne Mason fans out there, and I know this is going to cost me a lot of subscribers, but for the sake of your time and for the sake of my sanity, I'll be focusing on like the top tier Democratic candidates who have a chance at winning. And let's be honest, only 5 of them really do, but I'm going to try to do more than just 5, maybe top 10 or something like that, because I want to be generous. I'm being generous here, but I also want to be informative too, So first, all the candidates could kind of be brought into a few selection systems of healthcare that they want. They have their own little nuances in each of them, but I could kind of divide them. So as you can see on this graph here that I have in front of you, not a graph, but some sort of fucking timeline, looks like it. But so on the far left, we got Bernie with his true-to-form Medicare for All proposal, which would abolish most private insurance and would levy a 4% tax on all income. We got Warren and Yang's proposals, which are Medicare for All, but Warren and Yang are iffy on the abolishing private health insurance part and the extra tax on all income. Harris wants Medicare for All too, but it would not have the tax and it would have private insurance. And the way it would work would be like with Medicare, it would be like a Medicare Advantage plan, so that's where private insurance would be, but they would be regulated. And then towards the middle, we got Pete's Medicare for All, who want it, and Beto's Medicare for America ideas, which are everyone's enrolled, but you can opt out if you so wish. But they're kind of basically similar, which I'll go into soon. On the more right side of things, you got Delaney's idea. Delaney, the man, the man himself, the absolute unit. Which keeps Medicare the way it is, so nothing changes there, but moves everyone over to not everyone, everyone gets for the right of citizenship, a public system. And then on the right side of the spectrum, you got Biden and Amy Klobuchar, the solid woman herself, who wants a public option that competes with the private insurance that people can join if they wish. The difference between a public option and Pete's and Beto's plan is that Pete and Beto's plan would be the main option, the main thing everyone is, and you could opt out if you wish. This is just an extra. So there'll still be in Amy and Biden's plan, there'll still be a bunch of private insurance places, and people would still compete with, but there'd be a government option which you could enroll in if you want, which would be kind of compete with all the other private insurance, while as Pete's and Beto's would be a sort of how would you say it? It would be the main option, but there'd still be things that you could opt out of it, but everyone's covered under this. It's not just single option, it's the main option, and if you don't want that main option, then you could choose it. The other one is it's an option out of the many, if that makes sense. And then most everyone there, no matter who they are, supports negotiating down prescription drugs, allowing imported drugs from safe countries, or peg those prices to the average rate in high developed countries. And there's some differences, for example, the biggest one is Elizabeth Warren's idea for allowing the government to negotiate create generic drugs, I should say. So that's the thing. Now let's go to the main details. So the slimy, sloppy, the steak and choppy. So first is the man, the myth, the legend, the man who took down Corn Pop himself, Joe Biden. So, which is actually apparently a true story. I thought it was bullshit, but it was actually true. So it says, now Joe, he's been saying pretty base things recently, or at least he's been saying it in the past, and so he's running on continuing Obama's legacy and built on the Obama administration stuff. And nothing is as clear on that pursuit as his healthcare, which is probably the biggest thing Obama got done, to be arguably. Biden's plans to basically roll back all the changes Trump has done to the ACA, which I assume also includes bringing back the individual mandate. But the main crust in how he will build upon Obamacare would be a new public option plan, which would negotiate like Medicare does to lower costs, and it can be affordable. And as far as I'm aware, this one is open to everyone regardless of income, I think. He also wants with the tax credits to help middle class people. He wants tax credits to help middle class people afford private insurance, and he wants to cap how much they pay for health insurance premiums to 8.5% of their income. He would also automatically get enrolled if you use if you're at the poverty line, I think. He would also ban surprise billing, which the idea of surprise billing is basically, let's say you get hit over by a rhinoceros or something, and then they ambulance you to like some place in some other state, but it's not part of your insurance network, and then they price gouge you because you're not in their network. Well, he bans that. He wants to trust bust break down some large corporations, though he does not go into specifics on that. He has called for the government to negotiate down drug prices, and allow patients to buy consumer drugs from other countries, and then a specific tax break that allows drug companies to fund their advertising. And he also wants to repeal the Hyde Amendment, though that was recently. He's called for abolishing the Mexico City policy, restore federal funding to Planned Parenthood, and he would have an independent commission to determine drugs that have no competition to them. They have to set a reasonable price, and they can't be raised based faster than inflation. And he would pay for all this by having capital gains be taxed as ordinary income. So if the amount of money you make from capital gains, it would be the same thing as being taxed from income tax. Next is Bernie Sanders, and by the end of this video, I'll probably have a voice as hoarse as he got in the last debate. But hopefully not. Hopefully not. So while Biden is seen as the moderate on this issue, Bernie is seen as the most left-wing on this issue, and has probably single-handedly moved the discussion of the party where almost everyone wants to say they're for Medicare for all, but not actually embrace the real deal of it. And what Bernie wants is basically the real deal, what Medicare for all stands for. So basically what that is that every single American resident, including non-citizens, would be covered under a Medicare for all single-payer system, where all government healthcare is consolidated into a single program, which covers basically everything, with the exception of like cosmetic surgery. So we won't pay for you to get a larger set of boobs, but everything else is paid for, and I mean everything. There would be no private insurance, only ones that cover the boob enhancer healthcare. And he would also allow the government to negotiate drugs down, along with import them from other countries, and peg the price to the rates of other countries from 5 countries. Those 5 countries being the UK, Canada, France, Germany, and Japan. Now, this isn't on his website in the healthcare issue, but I'm going to give Bernie the benefit of the doubt and say he's also in favor of doing a lot of things Biden said, like funding Planned Parenthood, repealing Hyde, stuff like that. There's a few ways he would pay for that is like a 7.5% tax on employers, a 4% income premium, and removing healthcare tax expenditures. And there's he lists dozens more on what he wants, but those are the main things. So, what's next? So, I have a plan, I have a dream, I have to masturbate. So today we're going to be talking about Warren, or the next one's going to be Warren. We're not going to talk about her specifically. We actually will, but part of it. Okay, whatever. I don't know, I just started recording. Anyway, so what do I have on Warren? So what's Warren? She's a wonk boy, right? She wants to, she has a plan for everything, right? She's very wonky, and she is. I'll give her that. But where does she stand on healthcare? So she says she's in favor of Medicare for all, like Bernie, but hasn't outlined a specific plan for herself. So for all intents and purposes, what I talked about last time is what Warren wants, like what Bernie wants. However, she says she won't use the option of the 4% middle class tax to pay for it. So it would probably be one of the other options Sanders has laid out. Warren also has a plan for prescription drugs. Like others, she wants Medicare to negotiate prices down and allow the importation of drugs from other countries like Canada. But she also has a unique spin on it where, for example, this is where it comes in, where the Human Health and Human Services, with the HHS, would manufacture its own generic drugs when the drugs is being monopolized and has high prices for those drugs. She wants to pass a specific bill to expand mental health coverage called the Behavioral Health Coverage Transparency Act, which sounds gay. And then through her CARE Act, she plans on investing $100 billion over a 10-year time to combat the opioid epidemic. Some other things she wants to do is increase by 15% money in community health centers, a $25 billion capital fund to increase access to healthcare, and increase the cap medical residency in underserved communities to $15,000. I mean, to 15,000 people, that made no sense. 15,000 people. So yeah, pretty big brain ideas, but, that are going on here. I just don't think I can handle it. Next on our list is Pete Buttigieg. And I think I finally got his name down after hearing him for fucking thousands of years. But I think I got his name down. So his plan, which is easy to say, is called Medicare for All. Who want it? Get it? Who want it? Which means that Medicare will become a guaranteed public option to everyone who, and get this, wants it. So if you like your private plan, you can keep it and not be on the government plan. So it's basically a public Medicare option. He also wants to ban surprise billing. He wants to expand premium subsidies so that lower income families only have to pay up to $600 a year for gold tier healthcare, and then also cap marketplace premiums to 8.5%, which should help people above the poverty line pay no more than 8% of their money on premiums. He also wants to limit out-of-pocket expenses for lower income seniors, and he will bring down administrative costs by creating an all-payer claims database to harmonize standards and support electronic records, and use antitrust to break up big health insurance companies. Big brain, big brain. He also wants to spend $100 billion on a community innovation grant and decriminalize mental illness and addiction, so they're not treated as criminal issues. He also wants to expand the Conrad 30 program, which basically increases the amount of immigrant doctors that would work in rural areas so they could have more healthcare. And then part of his national service is a health court, which is used to fight addiction and give healthcare access and such. And he wants to spend $1 billion on a rural healthcare fund. And that's not everything. He has a lot more policies he wants to release, and that's not. He goes into very details. He actually has more detail than Warren, which is actually kind of surprising. But yeah, that's him. That's Pete Buttigieg himself, on where he's saying. So next is the drunk sailor herself, Kamala Harris. Now she's not actually drunk. It's just last debate she sounded drunk. I mean, was I the only one? Anyway, so it says she also supports Medicare for All. However, it is a longer transition, and it starts off as a public buy-in option, and it will take 10 years, with the uninsured and newborns transitioning into it automatically. So unlike Sanders' plan through private insurance, private insurance is allowed, but must adhere to strict financial standards. So it would sort of be like how Medicare works now, but with more benefits allowed, like mental health and stuff like that. And it would be like Medicare Advantage. Think of it like that. She also differs from Sanders' plan by using a Wall Street speculation tax to fund her program instead of a 4% tax on all Americans making under $100,000 a year. The Health and Human Services will see prescription drugs charged in other countries, and if the price is too high, there would be a set limit to those drugs to be only 100% over what it is cost in other countries. She would also allow the importation of safe drugs from other countries if the other plan does not go through. Damn, that was fast. So, Andrew Yang, the math person, the person in the race who, you know him because he always says he's the math guy, which, good. I need a math person in my school. Fucking math sucks ass. But what does this math guy think of healthcare specifically? Well, he also supports Medicare for All. Is there any sort of difference between him and, say, Sanders or Warren? Well, basically none, though when he talks about it, he puts more emphasis on how our current healthcare system burdens businesses. So it's a different way of talking about it, but I've heard that he also does not support abolishing private insurance. But refer back to the other Medicare for All plans from Warren and Sanders to see where he stands. He also wants to invest in mental health, quintuple federal funding to combat the opioid epidemic, and wants to negotiate prices for prescription drugs, like everyone else. Do you see a pattern with this drugs thing? I'm starting to get fucking loony from these things. So next is Beto, grab the AK-47s, there's the fucking general outside, O'Rourke. Now, where does this dude stand on healthcare? Well, surprisingly, guess what? It's something new. It's actually not Medicare for All or anything. It's Medicare for America, which is different from everything else by allowing people who are on Medicaid and Obamacare, newborns, and of course people on Medicare will be enrolled in this new program. But if you like your employer or private plan, you can keep it. But under this Medicare plan, under this plan, if you enroll this, you would still pay premiums, but it would be regulated based on your income. And we funded through a 5% income tax on everything over $500,000, and there would be new sin taxes on alcohol, tobacco, and sugar. And the Medicare payroll tax would be increased. And O'Rourke, like everyone else, also believes in negotiating drug prices down and drug prices to be reduced in relation to other countries and how much they cost. Again and again, I just have to reiterate that they still support the same thing. They all support it, so I'm just being repetitive here. Next on our list, and hang on folks, only 3 more. The next one is Well, actually, it would have been Castro, but he literally does not have a healthcare plaque to his website. So we will move on to Amy Klobuchar. So she supports a public option, and unlike Joe Biden, that's really it. Just keep Obamacare the way it is. Roll back the what Trump has done to Obamacare, and have a public option that is with Obamacare, and allow drugs to be imported from Canada and such. It's actually a bit different because the bill that she specifically says for a public option, it would have a Medicaid buy-in. It would not be a Medicare buy-in. And it wouldn't be one plan. It would be 50 plans because every state would have to set one up. And they would have to cap their premiums at 9.5% of their someone's income. So something new. But this is definitely the most so-called right-wing idea on healthcare. Next is John Delaney's Bettercare, which I know he's not in the top 10, but he will be the last one. And I know I only did 9 instead of 10, but everyone else has essentially the same policy mentioned before, either that be Medicare for all with provisos, public option, something between, but there's nothing new. It's either, something like that. But he actually has something different. It's called Bettercare. So is it actually better? That is up to you to decide. So what is this Medicare thing? So first, Medicare stays the same. There's nothing changing there. But there is a new public health plan that every American citizen gets, which would consolidate Medicaid and Obamacare into a singular program so every American citizen could get it. And then once you turn 65, you would transition from this public plan to Medicare. And would run on the same network like Medicare, the same healthcare network Medicare runs on, with the same rates. And you could opt out of this public healthcare plan and get your own private insurance plan, and would get a tax credit to fund it. And he also supports negotiating down drug prices. Just so you know. So that's the different ideas for healthcare more broadly in the Democratic primary, and I hope I showed you the nuances and the differences between Medicare for all, Medicare for all, and when people say they're for Medicare for all, how they pay for it, how they would actually fund it, and such like that. And then people who have different ideas like Medicare for all who want it, Medicare for all, public option, and what type of public option is it? Joe Biden's public option, which is like a Medicare buy-in, or Amy Klobuchar, which is 50 different types of public options funded through Medicaid. So yeah, I hope that was informative. Like, share, comment, subscribe, and check out my Patreon if you so wish. And aim high, wander on, from America with Russian love.